Okay, I'll be talking about the symptoms of pulmonary stenosis. So we can divide into actually mild, moderate, and severe pulmonary stenosis. So in mild and to moderate pulmonary stenosis, so usually the child will be asymptomatic. Um, asymptomatic, and the heart size will not be so enlarged, so the apical impulse is actually is normal. And then like in the moderate pulmonary stenosis, there will be the apical impulse will be normal, and for the JVP will not be raised in the mild pulmonary stenosis. In moderate pulmonary stenosis, it will be slightly raised, so there will be a prominent A wave in the JVP. This is usually in older child. So so since the heart is not enlarged, so the um, right ventricular impulse is not palpable here, not palpable, and there's slight right ventricular lift palpable in moderate stenosis. This is the at the lower sternal border. Okay, so in severe pulmonary stenosis, so the child will be symptomatic, so there will be a mild to moderate cyanosis. If the patient has the ASD or PFO, so but without this intracardiac shunt, the child can present as acyanosis. Without this, and there will be a sign of right ventricular failure, which is hepatomegaly, peripheral edema, and also exercise intolerance. Okay, and the JVP will be raised, which is the large A wave, and the heart is enlarged. So you can feel the right ventricular lift extending to the left mid clavicular line. So coming to the heart sound. So for the heart sound, there will be a sharp ejection click after the first heart sound. This is the pulmonary ejection click. So ejection click. At the pulmonary area, which is left upper sternal border. This is in mild pulmonary stenosis, and there can be a short or low or medium pitch systolic ejection murmur, which is the loudest at the pulmonary area, and this radiates to the bilateral lung field. So systolic ejection murmur radiates to the lung. And for the moderate pulmonary stenosis, there will be a split second heart sound. This is the delayed and soft pulmonary component. Actually, normally the heart sound is also split. And for the severe pulmonary stenosis, the heart sound, the pulmonary component of second heart sound is actually inaudible. Second heart sound audible. Okay, so for the ECG, actually for all they will show right ventricular hypertrophy changes. So it depends on the degree of the severity. So for mild, the changes is like inverted T in right precordial lead, which is V2 to V6, and the upright T in V1. This is normally inverted. There will be in moderate, there will be a prominent spiked P wave, and in severe there will be tall spiked P wave. For the chest X-ray, in the moderate stenosis, there will be mildly enlarged right ventricle which uplift apex. So here there will be a cardiomegaly, which is a prominent right ventricular and right atrium. So for the echo, when we do echo, for the mild pulmonary stenosis, there will be a slightly thickened pulmonic valve, and for the moderate, there will be a thickened pulmonic valve with restricted systolic motion, and for the severe, there will be a severe deformity of pulmonary valve with right ventricular hypertrophy. That's for echo. And for the treatment is balloon valvuloplasty. This is in the mild to moderate moderate to severe pulmonary stenosis. So the complications can be heart failure in severe cases. So for the critical pulmonary stenosis, there will be a cyanosis in neonatal period, and can be infective endocarditis, and there can be a progression of the stenosis. So if untreated, this leads to right ventricular dysfunction and also cardiac failure. Okay.